Welcome, everyone. My name is Robin Francis. I'm the Chief of Patient Safety here at BAMC. I'm also the San Antonio Market Lead for Patient Safety, and I wholeheartedly welcome each and every one of you to today's party. Let me get a yeah! All right. All the cowbell. I want to start by giving special thanks to our senior leaders, especially Brigadier General Ryder and Brigadier General Tahan, for coming here today and participating with us. I cannot see. This year, we're recognizing healthcare providers and their teams across the San Antonio market in celebration of Patient Safety Week. We're excited to take this time to honor each of you, laugh, and have some fun. Patient Safety Week is themed Self-Care for Safe Care. Over the past 3 years, we've faced unprecedented challenges, and our strength and resilience has been tested. As healthcare professionals, we often put aside our health and well-being on focusing for caring for our patients. We've decided to focus our efforts this year to practicing self-care because self-care is the key to safe care. Now let's welcome Colonel Yana Saunders, our Assistant Dean of Quality Improvement and Patient Safety from Shawshank, to present the winners of the 2022 DHA Ready Reliable Care winners, Limerick Contest, Superheroes, Health Equity Advocate, and Patient Safety Abstract Competition. Let's get the party started, man.
I love the energy and enthusiasm. We've had an incredible week of so many activities, educational and uniting activities, as well as some very impressive oral presentations yesterday and today delivered. We have so many people to recognize and award. So we're going to get started with the DHA Ready Reliable Care winners. This HRO Awards program recognizes initiatives that improve the military health system, seeking approaches and enhancements in both clinical and non-clinical areas that result in more reliable processes, better outcomes, and higher quality care. The goal of the awards program is to promote a culture of learning, sharing, and continuous improvement. In 2022, over 79 submissions were submitted, and the San Antonio market took home 5 awards. So before we begin, we ask that only the primary representative come up, but for those who also participated in these projects, please stand and be recognized with them. So the first award winner we have is Captain Zahari Chopev for high fidelity simulation of acute neurology enhances rising resident confidence. This is the results of a multi-cohort study. Congratulations. Awesome. All right. The second award winner we have is Captain Matthew Geringer for implementation of rapid HIV screening program in the emergency department. Congratulations. Next, we have Captain Joshua Lester for a quality improvement project, Rapid Response EEG headset reduces time to determination of non-conclusive status epilepticus at a level 1 trauma center. It's a mouthful. Congratulations. And again, we've got Captain Stephanie Hoffer for determining progesterone threshold for fresh IVF cycles in a military treatment facility.
And our final award winner is Major Joseph Yabez for rapid initiation antiretroviral therapy by virtual health in science members newly diagnosed with service members newly diagnosed with HIV. All right. We are now going to move on to another fun and energetic awards. This is the Limerick Contest Awards. All right. The Limerick Contest continues to be a real staff favorite, providing staff an outlet for creative expression. This year, we had 19 Limerick submissions that showcased patient safety in so many creative ways. A panel of judges determined the following 3 winners. All right. In third place, we have Captain Casey Soares, Inpatient Pediatrics RN. I'm going to attempt to do it justice. Here we go. There once was a nurse on peds who strived to meet all her patients' needs. She had many good catches, verifying name and date matches, so patients take their meds with ease. Congratulations. Yeah.
That might be the new North Core Limerick.
All right. All right. In second place, we have Duncan Moskowitz, Department of Rehabilitation PI Coordinator. That's awesome. Here we go again. All right. All right. During Patient Safety Week, let's cheer for all the precautions we hold dear. The value of a good catch will teach. Self-care for safe care is what we preach. Zero preventable harm, our goal is clear.
All right, so when we submit our packet to Joint Commission, we'll just put that on the cover letter. Right, and we'll submit the Joint Commission packet together with that Limerick on the top.
Awesome. Good job. All right, and in our first place winner, we have Dina Miller, Pediatrics Lactation Consultant. Make sure we're quiet. All right. There once was a baby that snuggled, and kangaroo holed while he nuzzled. Safely tucked in with blankets, skin to skin, this kept him warm, calm, and huggled. All right. All right, we're going to move on to our Superhero Awards. The goal of the Superhero Awards is to honor those interdisciplinary teams and individuals who exemplify outstanding delivery of healthcare through the tenets of a high-reliability organization and have a strong foundation in interprofessional collaboration and respect. The winners were selected by an interdisciplinary team in the categories of professional, paraprofessional, leader, and team. In the category of paraprofessional, our winner is Private First Class Nathan Cruz. I love it. His wife is here with him today to support. Yeah. That's awesome.
I think it goes 3 West is the best, right?
Yes, that's all right. PFC Cruz is an LVN on 3 West at BAMC. Recognized for identifying PFC Cruz is recognized for identifying an IV bag medication incorrectly labeled as azithromycin, but was actually Protonix. And during his shift change, he conducted a debrief of the events with his team, sharing lessons learned. Thank you. All right. In the category of professional, our winner is Major Christian Vernau, a staff anesthesiologist. Major Vernau is a staff anesthesiologist recognized for his contributions as the Quality Improvement Patient Safety Staff Champion, mentoring 4 projects. He is also a super user of MHS Genesis and has provided countless hours of staff trainings and elevated multiple issues related to the new system. In the category of leadership, in the leader category, our winner is Miss Tamara Pasut, PR coordinator. Ms. Pasut is a PI coordinator for the BAMC Department of Pediatrics, recognized for leading a team to improve ABA referral processes, resulting in sustained 20% improvement in referral processing during a time of 46% increased workload. She serves as a mentor for 35 pediatric residents and interns and assists in developing their QI initiatives. Thank you. And finally, we have had many impressive high-functioning teams nominated for our team award. However, the Randolph Pharmacy stood out by its teamwork to develop and implement a DHA-wide standardized method to correct the MHS cash claims. Doing so prevents overdoses and abuse related to the lack of visibility of other retail and mail-order pharmacy prescriptions. So this is our second year of the Health Equity Advocate Award, which honors those individuals who have dedicated themselves to increasing awareness of and identifying healthcare disparities in the military healthcare system. We received multiple submissions this year with a remarkable increase in the deliberate recognition and praise for those among us who demonstrate passionate advocacy for health equity. This was a very difficult selection, as truly each of the nominees deserves special recognition for the incredible advocacy that they role model. The nominees were Dr. Bradley Bishop from anesthesiology. You can stand if you're here. Dr. Jackie Hayes from pulmonary critical care. Dr. John Gankaiko from gastroenterology. Dr. Aaron Kaiser from obstetrics and gynecology. Dr. Letitia Lyons-Watson from obstetrics and gynecology. And Dr. Craig Ugawa from internal medicine. So this year's recipient of the Health Equity Advocate Award goes to Lieutenant Colonel Aaron Kaiser, Staff OBGYN and Program Director for the Gynecologic Surgery and Obstetrics Residency. Dr. Kaiser demonstrates genuine concern and passionate advocacy to improve undeniable disparities in racial outcomes in women's health. She is a role model for integrity as she openly addresses race and gender matters in academic and clinical learning environments and encourages constructive and compassionate dialogue across all levels of healthcare. Lieutenant Colonel Kaiser spearheaded the first publication identifying healthcare disparities in severe maternal morbidity among active duty service members and their families. For the last 4 years, she has diligently scrutinized data across the MHS, producing 3 national societal presentations and garnering an avid interest in further study. Her 2021 publication highlighted disparate health outcomes despite presumed uniform access to healthcare within the Department of Defense. Following this revelation, a series of new insights and investigations and publications has followed, expanding awareness activities toward achieving health equity. She has more than demonstrated a genuine passion to raise awareness and improve outcomes for all women in the MHS.
I'm going to do an Omaha here. I want to take a moment on that one. You know, when you think about military healthcare system, I wouldn't be here if I wasn't a huge fan of it for 30 years, right? I love it, but we think that everyone that has equal access to us, because we are a uniform system, there is no tiers in how we do medicine. Everyone is equal access to come in and make an appointment, and it's free, especially for our beneficiaries and our family members. And that article was a real eye-opener to the fact that we still have a long way to go, despite the fact that we don't have the equity challenges our civilian partners have in insurance and non-insured and all those other things. We still have a challenge, and I just wanted to really thank her for that article and really changing the conversation across all of military healthcare systems. So I know she's not here, but if we give her a round of applause, that was really well done.
Thank you, ma'am. All right, the 8th annual Patient Safety Week abstract competition was open to all staff in the San Antonio market as a way to highlight quality improvement and patient safety projects. The top abstract presentations were determined by a multi-member interdisciplinary judging panel, which rigorously scored the use of science of healthcare delivery and the scope of their projects. This year, we had projects submitted from almost every department, representing a significant amount of work to improve patient safety across the market. All of the abstracts are impressive, and the authors should be proud of what they've accomplished. I ask that everyone here who has participated in one of the presented projects please stand now to be recognized. We genuinely want to thank you for all of your hard work and commitment to improving the quality and safety of care here. We're now going to recognize our top 5 presenters, and we ask that only the primary representative or representative come up to receive the award, but those who participated in the projects are certainly welcome to stand and be recognized with them. The HRO category of leadership commitment to quality improvement and patient safety is Lieutenant Colonel Michael Gwindon from Pediatrics and Neonatology. For his project, Improving Patient Safety Event Feedback Using a Standardized Presentation Process. Dr. Gwindon's project has received much enthusiasm with continued interest growing across programs of different disciplines. His project demonstrates a true application of the next iteration of a PDSA cycle, sharing, expanding, and improving best practices. Congratulations. The winner of the HRO category of patient safety goes to Captain Caitlin Mullen from Pediatrics. For her project, Neonatal Fever ED Clinical Pathway, a QI initiative to improve early identification of high-risk infants and patient-related outcomes. Dr. Mullen conducted a well-designed project adhering to the QI PDSA principles with multidisciplinary management and collaboration. Congratulations. The winner of the HRO category of patient-centeredness goes to Captain Andrew Wilson for his project, Virtual Clinic to Optimize Management of Heart Failure with Reduced Ejection Fraction, providing innovative care to improve timely achievement and adherence to multidisciplinary guideline-recommended care.
Woo! Congratulations.
Congratulations. The winner of the HRO category of continual process improvement goes to Captain Kelly Ivins O'Keefe from Anesthesia. For her project, Reducing Unnecessary Intravenous Acetaminophen Use in the Perioperative Period. Dr. Ivins O'Keefe proved incredible persistence with collaborative work across departments, with clearly identified goals and balancing measures, and an impressive cost analysis for savings. And our last award is the winner of the Health Equity category. And the winner goes to Captain Bradley Bishop from Anesthesia for his project, Spanish Phrases in Anesthesia. Okay. Dr. Bishop designed and implemented a project recognizing and addressing social and safety concerns of language barriers that persist despite what many perceive to be an equal access to care, single-payer military health system. His efforts not only aid to garner patient understanding and trust in their care, but also the confidence and competence of our providers. I'm going to hand things back now to Ms. Francis.
I'd like to give the opportunity for remarks from our senior leaders.
Can you hear me? Oh, yes. Yes. What you're saying, Command Sergeant Major, is I don't usually use a microphone. Sorry about that. Now I'm all fine. There we go. So thank you for being here today. But though there's singular awards, there is a lot of effort when we talk about our patient safety. And we could talk about the numerous things that have been going on during the pandemic. And then especially when you talk about pandemic, and then we talk about a new electronic medical record. And everybody will say that MHS Genesis has been smooth.
Say who?
Oh! Thank you for being here, Command Sergeant Majors and Chief Master Sergeant Earls, because our senior enlisted are in the house, and they should always be, and all our senior enlisted are our leaders here. And so I just want to thank you for what you do every single day. I know that everyone who comes into this building, or the other 11, or the WASC, or the other 11 clinics that we have, everybody wants to give their best care every single day. However, we also know that there's processes we need to improve on, systems that we need to improve on, training and education, and then there's not only the risk, because you take care of, especially here at BAMC, the most complex patients in the entire DoD. But then you are also training and educating 1,200 learners from our Phase 2 enlisted all the way to our fellowships. And that is why I always say the center of gravity for medical readiness and training is here. And Dr. Rentz is like, oh, how many times do we have to hear that? But I will tell you is that the first time I was ever stationed here in San Antonio was April 29th of 2021. I have never been stationed here. And I would listen to people say the center of gravity is San Antonio, and I'm like, stop saying it. But then within 48 to 72 hours, you realize what all of you do every single day to provide safe patient care, positive patient outcomes, and that you are committed and dedicated to each patient, each family member, because it's complex and it's hard. And so we are very honored that we are able to take care of the sons and daughters. When you talk about all the trainees that come here in our Air Force, it's the basic military trainees and tech. And then we are also taking the grandfathers and the grandmothers. And so when you talk about health disparity and those kind of things, I don't know how many of you know, but I have some 20-somethings, and they now know how to make their appointments. But we get young people who don't even know how to use the bureaucracy of our system and how to make an appointment. And so that's an issue. And then we have grandparents that we want them to use the technology of today in the portal. And I can tell you, if my parents are on the line, my dad, he can use our technology. My mom, she's going to call you. And so all that Swiss cheese every single day, and you do amazing work. And so I just want to thank you for what you do, how you serve and are committed, not only to patient, safe patient quality care, but to the training of all the medics that take care. And so, General Tahan.
All right. Well, as we finish out Patient Safety Week, what I'd like to first do is, if you're on the Patient Safety Awareness Week team that helped plan any of the events, whether here at BAMC or at Randolph or at Wolford Hall, could you stand up to be recognized? They've done a phenomenal job, and we have a requirement here at BAMC to go above and beyond in events like this because we are a training platform. If you think about how you practice medicine today, most of the time, 90% of what you do is based on what you learned in your training platforms. We go to continuing education courses, we go to conferences, but most of the time, that is not sufficient to create behavior change. You come back from those training, you're all motivated on Monday, and by Tuesday, you're doing practice just like you've always done it. And we've proven this scientifically over and over again, that although our requirement to go to continuing education is part of our licensure, it doesn't change practice. What changes practice is starting creating good habits from day one, and that requires having training platforms like BAMC that just make safety part of the conversation from the start. And since we do have the largest training platform in DoD, when you look at GME, Allied Health, and all of our phase 2 training, every day our staff is required to make sure we're teaching safety as a foundational skill in everything we do. And so weeks like Patient Safety Week, or the survey that I'm sure all of you have already completed in this room, and you've recruited 5 to 10 other people to recruit the survey, we have a real need to make sure we do that, so that all of our new nurses that come here for their first assignment, or all of our new physicians, or all our new LVNs and 4Os that come to this facility, all they know is this BAMC and in Wilford Hall and the Randolph Clinic standard, which is safety is foundational. And so I appreciate that. However, I have a challenge for you as we move into the next year. I think after, and I'm not sure if this is going to work or not. You guys could totally make this bomb, but we're going to try it. I'm just going to let you know up now. I might fail at this, but we might try. But the challenge for this next year for all of you is to bring joy back to medicine. We put joy on the shelf during the pandemic, right? We struggled. We got the mission done. We were fearful of what we didn't know at the start. Then we were out there working on the front lines, and we did that, and we became tired, right? We always put others over self. But over the last 3 years, we've done it to a larger extent. So my challenge for you is to bring joy back to healthcare. Now, this is the part that may or may not work depending on audience participation. So I'm going to ask you all to stand up and join me in singing
Yes.
with the Plantonics. Ready?
Love it.
I hope this works.
Joy to the world. Joy. Stood a single word he said, but I helped him a drink his wine, and he always had somebody by the wine.
All right, I'm glad that worked out. Thank you guys for participating. But I just want to say thank you all. I think we have a huge task ahead of us. We have a huge task ahead of us of bringing joy back to medicine, but we owe it to all of us that we do it. And patient safety will only improve if we are enjoying what we're doing and we actually know we have each other's backs and that we are here for each other and we know we're a family and we're a team. So as we move into this next year, let's make that a focus of bringing joy back to the San Antonio market. I'll turn it over to the team. Thank you, guys.
Yes! As we close today, I'd like to thank everyone for attending. Let's give everybody one more round of applause. And let's now rise for the departure of the official party.